Imagine you spent years preparing. You have food, you have water, you even have emergency supplies, and you may have even purchased land and built yourself a community. But then one day, a tooth starts aching. And at first, it's annoying. Then it becomes distracting. Then it becomes unbearable. And then suddenly, all those preparations don't matter because you can't sleep, you can't eat, you can't think clearly, and the pain feels like it's taken over your entire life. So today, we're going to discuss the most overlooked areas of preparedness, dental health. And also, we're going to go over why taking care of your teeth today may be one of the smartest preps you can make for tomorrow. Peace, I'm the Modest Prepper. Now, section 1, why does dental health matter? Now, number 1, it's obvious, okay, why dental health matters. But most people don't think about their teeth until something goes wrong. And the problem is that dental problems rarely get better on their own. Small cavities becomes large cavities, small infections become serious infections, and minor discomfort can lead to excruciating pain. And anyone who has experienced a severe toothache knows exactly what I'm talking about. It can make it difficult to focus on work, difficult to sleep, to eat, to function. And during a crisis, that becomes even more dangerous. Now, so far, I've often talked about halal food security and water security. But what good is having food if you're unable to chew it? What good is having emergency supplies if you're overwhelmed by constant pain? Dental health isn't cosmetic. It's part of your overall health and your readiness. So section 2. Now, for those who've been following me, you know I always got a story. So here's story time. So I recently went to the dentist and I had a little work done. And my husband said, hey, just ask the dentist, worst come to worst, if everything just go haywire and you don't have access to, the normal channels, hospital, dental, and all that, what would you do? So at the end of the appointment, I asked her, and what she told me was eye-opening. She said that what you're speaking about is basically what we went through at the beginning of COVID. She explained that at the beginning of COVID, that was the closest thing that many dentists have experienced to large-scale disruptions. And she said during that period, many dental offices, including hers, had severe restrictions. And in some situations, they couldn't perform normal procedures, like they couldn't do the fill-ins because, she said aerosol generating procedures such as drilling were heavily limited or postponed. So that means many patients couldn't get routine fill-ins or other treatments that they normally would have received. And instead of fixing the problem immediately, many people were simply just trying to manage pain and prevent infection until treatment became available. So, and she said that, I was like, man, just think about that for a moment. This wasn't a complete societal collapse. This wasn't, Shtf, stuff goes haywire. This was just a temporary disruption. And yet, even then, access to dental care became significantly more difficult. Now, imagine a larger emergency, and this is why dental preparedness deserves so much more attention than it gets. Because she told me that, during that time, if things kind of go crazy, if you're talking about total collapse, she said what I would get is antibiotics to prevent infection and having some painkillers. But she said besides that, she said, God forbid, somebody has to take your tooth out with a pair of pliers, and just a thought about it made me cringe. She said, I don't think those pliers will be very, sanitary. So she said, you got to be careful and take care of your teeth now. So section 3, what's the importance of prevention now? The best dental emergency is one that never happens. One of the most valuable things you can do today is address dental problems while professional care is available. And if you know you have a cavity, don't wait. If you know you need dental work, don't postpone it indefinitely. If you've been putting off a cleaning, schedule it. Because prevention is almost always easy, less painful, and less expensive than dealing with a major dental problem later. So it's better to get your cleanings now, have your doctor check in for fillings. I know many hate the dentist, and when I say many, I'm including myself. But it's better than going there a year from now, find out you got a cavity, or you have to get a fill-in, or you have to get a teeth pulled because you let things go on for too long. And many preparedness-minded people, they spend thousands of dollars on gear while ignoring a dental issue that they already know exists. Sometimes you can feel that little throb in your mouth and you're scared to go to the dentist, and that's understandable. You're thinking, what if the dentist tell me I got to get a tooth pulled, or what if the dentist tell me I got to get a fill-in? And I hate it, and I hate that as well. So I get it, but it's just something we have to do, And that cavity doesn't care about how much food you store. It doesn't care how many generators you own. Eventually, it will demand your attention. So, Section 4. What are some dental preps that make sense? Now, in addition to maintaining good dental health, there are some reasonable preparations that people often discuss. Of course, you want to have your basic oral hygiene supplies. You want to have extra toothbrushes, so that way if one wears out, you have one that you can have on handy. Toothpaste, floss, antiseptic mouth rinse. You can also get some temporary dental repair materials that are designed for short-term emergencies. You can get those. I think there's one called Dentec, I believe. I'm not sure what the reviews are on it, but it's just some options you can look up. And of course, discussing medications with your healthcare professionals and understanding what's appropriate and legal to keep on hand for your circumstances. And pain management, it becomes important because dental pain can be intense. If you ever had a toothache, you already know what we're talking about. So infection management is more important because untreated dental infections, it can become serious. The key is preparing responsibly and legally while professional care is still available. So, Section 5, the reality of tooth extractions. Now, sometimes in preparedness circles, people casually talk about pulling teeth if things get bad enough. We've had conversations, and it's always in a joking manner. But the reality is far more serious. Pulling a tooth is a dental procedure. It involves infection risks, bleeding risks, any pain, and potential complications. And the image of just grabbing a pair of pliers and pulling a tooth might sound simple in movies, but in reality, it can create far bigger problems. And the goal should never be reaching that point. The goal should be prevention, taking care of problems now while trained professionals and proper equipment is available. So Section 6, just a little perspective for those thinking about kosher, halal, or anything like that. When it comes to what we're talking about, preparedness, it's not about living in fear. It's about responsibility. And we do what we can do, but then we ultimately place our trust in God. We can only prepare for what we can prepare for. And taking care of our health is a part of that responsibility, including our dental health. The mouth is how we eat. It's how we speak. It's how we interact with the world. And neglecting it can affect every area of your life. And having a dental problem is not just the pain associated, but not taking care of your teeth can affect other areas of your body. It can affect your organs. It can affect your health. It goes so much deeper than the pain and the affection in the mouth. So caring for our bodies, it's a part of gratitude for the blessings that we've been given. So if there's one takeaway from this video is this: don't wait for a crisis to start caring about the dental health of you and your family. A severe toothache, it can make every other preparation feel insignificant. And taking care of small problems before they become large problems. So schedule the checkup, get the cleaning, address the cavity, build reasonable dental preparedness into your emergency planning. Because one of the most overlooked survival preps isn't just another gadget. It's a healthy mouth. And if you have a dental professional in your community or in your family, you are lucky. So let me know in the comments, what do you think about this video? Do you think dental preparedness gets enough attention in the preparedness community? So if you found this helpful, please like, subscribe, and share for more videos. And as always, this is the Modest Prepper reminding you to take care, be grateful, and prep with intention.